Welcome to Nursing Education. This is the first video for this channel, and for this first video, I believe the goal for this presentation is to discuss these two topics very briefly. I don't want to go for too long, but it's called health promotion and disease prevention. So health promotion, just to sum it up, is to promote the individual's health, and that's through many different avenues, but primarily that's their well-being, so the individual's well-being. So you take an example of, let's just say, a 20-year-old male or 20-year-old female, and you want them to have the optimal health condition. So if they are perhaps they're not sick, they're able-bodied, they have full mobility, no disabilities, mental or physical. You want them to go beyond simply the status quo. You want them to have the optimal health, which means in their case reaching their full potential, whether that means increasing their stamina, their endurance, their strength, and their knowledge of being able to live a healthy life. And that's through diet, eating the right foods, healthy foods, getting adequate sleep, 7 to 8 hours a night, and having a good social support system, spiritual health as well, looking at their place in their community. And one thing that probably is not focused enough when we talk about health promotion is the focus is really, the emphasis is on the individual rather than the community. But if you promote health in the lens of looking at yourself as part of something bigger than yourself, then that can have a greater impact, not just on the individual, but on society as a whole, because society really starts from the home, the family. And when you when you zoom out a little bit, you look at the macroscopic effect, you look at your immediate community, your municipality, and then zooming out even more, you look at the city you live in. What kind of impact does your individual health have on the rest of your community, which is not just the community you live in, municipality, but even the city you live in, the province or state you live in, and even the whole country, the nation, and then you look at the global effect. So just focusing on yourself, be the change you want to see in the world, can make a huge impact, can have ripple effects. Now lastly, I want to go over prevention. So not really health prevention, disease prevention, because health prevention would kind of defeat the purpose of this video. So there are 3 levels of prevention, beginning with primary prevention, which is to provide protection against a disease or condition before there are an occurrence of signs or symptoms. So for example, if you have somebody who has not smoked yet, you want to promote a healthy lifestyle which does not include smoking, does not include excessive or I should say abuse of drugs or alcohol. In a nutshell, primary prevention is just protection against the disease. It's promoting protection. So you are promoting healthy lifestyle habits and practices. So that would be primary prevention. Secondary prevention is promoting early detection of a disease. So for example, you would be screening for cancer using various diagnostic tests such as mammography and even self-examinations such as breast and testicular examinations, and you have blood pressure screening and other methods such as blood sugar screening to detect diabetes, for example. So that, in a nutshell, what it is promoting early detection. So we have the primary prevention, which is, again, protection against symptoms before they appear. And then you have secondary prevention, which is promoting early detection. So primary is protection, secondary is detection. Lastly, we have tertiary prevention, which is a fancy way of saying third. But tertiary prevention includes activities directed toward minimizing residual disability. So the key word here is minimizing disability from disease and helping the client to learn to live productively with their limitations. So this would be a case where the person is already affected by their illness or their condition. So primary, again, was protection because they have no illness. Secondary is detection, whether they do have an illness. And tertiary is they have the illness now, so what do we do in order to improve their life, their quality of life? And examples of this would be cardiac rehabilitation programs following a myocardial infarction. And I'm just going to insert my own example here is you're looking at physical therapy for those recovering from a debilitating stroke. So they had paralysis in one side of the body and physiotherapy, occupational therapy to help rehabilitate them, gain their strength back so they can resume a somewhat more normal life, or at least improve their standard, their quality of living, so that they can move forward with that illness, but move forward in a way that makes life more optimal for them. So yeah, you're not just going to give up on them. They're not going to give up on themselves. You're going to promote healthy practices toward an optimal lifestyle for them within the parameters of their abilities. Because yes, they have a condition. Perhaps it's reversible or perhaps it's irreversible, but whatever the case is, you are there to promote their health and to provide support. So that's all for this video. Thank you very much. I hope this is helpful for you. Once again, this is health promotion and disease prevention. Please subscribe and like this video if you like more content like this. We're going to release more content in regards to nursing education.